We acknowledge that the country for Aboriginal peoples is an interconnected set of ancient and sophisticated relationships, from Sydney to the Southern Highlands to the South Coast, from freshwater to bitter water to salt. We pay our respects to leaders past and present. This is a third video in a series of 3, and it is a collaboration between the Illawarra Shoalhaven Local Health District and the Palliative Care Outcomes Collaboration. In video 1, we introduced the PCOC assessment tools and how an allied health team has implemented these tools into routine multidisciplinary practice. In video 2, we heard from the allied health team about their experience using the PCOC assessment tools. In this video, we will focus on the purpose of the Edmonton Symptom Assessment System, ESAS, and how it can be used by multidisciplinary teams, and also the experience of patients using this tool. ESAS is a patient-reported assessment that measures the experience of 11 common symptoms.
In PCOC, we use the 5 PCOC assessment tools to provide a holistic evaluation of the palliative care patient. This approach guides and informs the development of the care plan and helps clinicians address the needs of the individual and the family carer more efficiently. Today, we will be talking in detail about our patient-rated symptom assessment tool. Since PCOC started in 2005, we have been using the Symptom Assessment Scale, or SAS tool. This tool gives a voice to individuals and their family and carers in sharing the symptoms and problems that are worrying them. Clinicians can use this information to plan care. After extensive consultation with the palliative care sector and with patients and their family and carers, PCOC is changing to the Edmonton Symptom Assessment System tool, also known as ESAS. ESAS is very similar to the SAS tool, but provides a more holistic assessment by including items such as depression, anxiety, and well-being. You can subscribe to our PCOC newsletter for regular updates on the change from SAS to ESAS. We will be supporting services to make this change through providing updated education and resources. Using ESAS is much like using SAS. The tools are very similar, and we will keep using the symptom ruler for people to score their symptoms. ESAS can be used by any discipline to help individuals discuss their concerns with their clinical team. It is best when individuals can discuss and rate their own symptoms, and they can use a proxy like a family member or staff when they can't rate their symptoms themselves. It is important to use plain language and encourage individuals to ask questions if they don't understand something. Interpreters should also be used when needed. We will also be developing multilingual versions of ESAS. When using ESAS, we recommend that the well-being score is assessed last. By asking, "How do you feel overall out of 10?" at the end of the assessment, gives an opportunity for the individual to provide a holistic response that captures their general emotional well-being. In this next video, we will show you a demonstration of an allied health worker using the ESAS tool to support a person's voice in their palliative care.
Hi Frank, I just wanted to talk to you today about some of the symptoms that you may have had over the past 24 hours.
Oh, okay. Yeah.
I just want to make sure that we're managing your symptoms as best we can and that the plans in place are working for you.
Yeah, okay.
So I'm hoping that for each of the symptoms or problems, you can give me a score between 0 and 10. 10 being that it's bothering you,
Okay.
and it's the most severe it's been. 0 being that the problem is absent or not there.
Okay.
Okay.
Right, fine.
So over the past 24 hours, have you had any pain?
Yes, I have. I've had pain in my back, my lower, where the tumour is. Yeah, and it's constant.
Pretty constant?
Yeah.
And what would you rate that between 0 and 10?
5.
5?
5 out of 10.
Okay.
Yeah.
So it's bothering you a little bit. Have you had your pain medication today?
Yes, I have. I've had. Yeah, actually, I've had an extra tablet.
Okay. And the pain is still there?
Yeah.
All right.
Yeah.
And have you had any fatigue over the past 24 hours?
No, I've been fine. My energy levels are good. Yeah, they're fine.
Great. And any concerns with your breathing?
Yes, I get puffed. I do get puffed a bit, especially when I'm in pain. Yeah.
And so what would you rate your breathing over the last 24 hours?
6 out of 10.
Okay,
Yeah.
that's quite high
Yeah.
then, isn't it? Yeah, okay. So this is a bit of a funny one, but how have your bowels been over the past day? Have you had any constipation,
Yeah.
or have they been pretty normal?
No, my bowels are good. My bowel movement's fine. I've got no problems with that.
No problems?
Yeah.
What would you rate that between 0 and 10?
Oh, 0, really, yeah.
So
Yeah,
very
that's fine.
regular, normal.
I'm fine.
Lovely, Frank. That's what we like to hear. Have you had any nausea over the last day?
Yes, I have. I usually feel nauseous after breakfast, but it doesn't last long. I'm not too worried about that.
Okay, and what would the score be for that?
Maybe a 2.
2,
Yeah.
so pretty mild.
Yeah.
Yeah, okay. And have you been feeling hungry? Have you got a good appetite?
No, I don't feel like eating. I'm not hungry at all, but it doesn't really worry me.
Okay, that doesn't worry you either?
No.
What would you score that 1 out of 10?
Maybe a 3 out of 10. Yeah.
Okay, that's good to hear, Frank. So Frank, how have you been sleeping?
Oh, terrible. Yeah, I'd rate that 9 out of 10.
9 out of 10. And is that new for you?
No. I keep waking up maybe 2 or 3 times in the night to go to the toilet, and when I come back, I can't get back to sleep, and I start thinking, and I think about my wife and what it'll be like for her, when I'm gone.
Those are really valid thoughts, Frank. How would you feel about me referring you to someone in our team so that you can explore them a bit more and we can figure out some practical strategies?
Yeah, that would be really good. It would be good to talk to somebody, not in the family, about what's going on in my head.
Yeah, absolutely. Yeah. And how would you describe your general state of mind? Are you feeling depressed or anxious?
I'm feeling a bit down for sure. I'm having trouble sleeping at night. Yeah, and I worry about my wife and how she'll be when I'm gone.
And these thoughts sort of pop into your head?
Yes, yeah, 2 or 3 times a night.
Yeah, it would be really helpful for you to score this symptom like we have the others. On a scale of 0 to 10, how severe would you say your depression is?
Probably about 6 out of 10.
6 out of 10. And would you say you're anxious, Frank?
No, I'm not an anxious person. I'm just feeling a bit low, a bit down.
Thanks, Frank, for sharing this with me. It's really important that we know these things so that we can get you in touch with the right people from our team. It sounds like these are really distressing and keeping you up at night. Would you say that's an accurate assessment?
Yes, I would.
So Frank, it worries me how much these worry you. I think it's really important we put you in touch with our social worker just to work through these thoughts that you're having.
Oh, good. Yeah, good. That would be good to talk to somebody, not in the family, about what's going on in my head.
Yeah. Finally, Frank, bearing in mind all of these other symptoms, how would you rate your overall well-being? How have you been feeling?
Well, considering I'm having so much trouble sleeping, I probably rated about 5 out of 10.
Thanks, Frank. It's really helpful for you to answer all of those questions. We as clinicians want to know what's happening for you so that we can track your changes and make sure your care plan suits you. Are there any other symptoms that we haven't talked about today that have been bothering you?
Yes, I've got pain in my lower legs and they're feeling heavy, and that stops me walking.
So you've got a bit of swelling in your legs. We can put you in touch with some of our allied health team to give you some strategies to manage that. For now though, it would be really good if you put your legs up and elevate them when you're sitting down or when you're lying in bed, and making sure your skin is taken care of, so moisturising and keeping it healthy.
Oh, okay. Yeah, thank you.
Judging by Frank's 9 out of 10 score for his sleeping issues, he would be in the unstable phase. The most clinically appropriate response would be that we need to escalate this urgently. Communicate this to the team and others, like Frank's GP, and reflect this in the care plan. We then need to review Frank in 24 hours to see if the new plan of care has effectively managed this symptom.
This concludes video 3. We thank the Palliative Care Allied Health team for their time and ongoing support for PCOC patients and their families and carers. We would also like to thank the PCOC consumer representatives for their valuable input.